Oral hygiene, toothbrushing, and interdental cleaning. Proper oral hygiene is necessary to remove plaque biofilm, which is a buildup of bacteria and debris on the tooth surface. This accumulates in the absence of brushing and can cause hard bacterial deposits, cavities, damage to gum tissues and supporting bones, as well as tooth loss. Manual toothbrushes have three main parts: the head, which holds the bristles, the handle to guide the brush, and the shank to connect the two ends. It's important for a brush to have round-ended bristles to prevent damage to the tooth surface. Manual toothbrushes conform to patients' size, shape, and texture preferences. As seen to the right, there are many options of manual trim brush profiles to suit all preferences. Although manual toothbrushes have a great range of options, powered toothbrushes have a greater advantage due to the rapid pace of bristle movement. There are many factors influencing the reason for purchase of a toothbrush. Generally, powered brushes are more expensive than manual toothbrushes. The brush handle should be comfortable to hold and maneuver inside a patient's mouth. The head should not be too large, therefore, a small head is recommended. The status of the gums is considered due to issues such as recession, which may prevent purchasing of a brush due to pain in the area. The position of teeth reduces the effectiveness of a regular brush when teeth are malaligned or missing. Some patients may be sensitive to texture, so it's important to find a brush they are comfortable with. Although medium and hard bristles are offered, patients should select a soft or extra soft bristled brush. For brushing to be effective, patients must brush twice a day for 2 minutes, applying only a pea-sized amount of toothpaste to the brush. Using a soft bristle brush, apply light pressure on the tooth surface to scrub. Grasp the handle with the palm and fingers and angle the brush like you would a flute. The following clips will demonstrate the correct brushing techniques. The Stillman technique. Grasp the handle with the palm of the hand. Place the bristles against the gums and the base of the tooth at a 45-degree angle. Applying light pressure, wiggle the brush back and forth 3 to 5 times. Move the brush to the next few teeth just overlapping the previous area. Repeat on the remaining areas of the teeth. When brushing the back sides of the teeth at the front of the mouth, reposition the brush with the handle somewhat vertical and repeat the same motion. You will need to reposition the handle when brushing the surface with every method. The modified Stillman technique. Using the same technique as the Stillman, hold the brush at a 45-degree angle and wiggle the bristles back and forth. Add a roll-down motion against the teeth and repeat. The Stillman and the modified Stillman methods are used for patients with gum recession. The Bass technique. This method is recommended for patients without gum recession. Grasp the handle in the palm and place the bristles at a 45-degree angle against the base of the gums and the top of the tooth. Brush in a circular motion so that the bristles are angled into the gums using light pressure. Repeat this motion using overlapping strokes on every tooth. The modified Bass technique. This method is also recommended for patients without recession. Using the same technique as the Bass, place the bristles at a 45-degree angle and make circular brushes, this time adding a roll down after about 5 strokes. Although the methods demonstrated so far are great for gum stimulation and health, if done incorrectly, they can damage or further damage the gum tissue. The Folds technique. This method is recommended for children because it is easy and requires little technique. Grasping the handle in the palm, place the bristles at a 90-degree angle and brush the top and bottom teeth in a circular motion. This is not the most effective way to remove plaque, but it is a great start to involve children in brushing. The Charters technique. This method is recommended for patients with orthodontic appliances such as braces. Grasp the handle in the palm and place the bristles at a 90-degree angle pointed down to clean the top of the appliance. Apply light pressure and wiggle the brush 3 to 4 times. Move to the next area and make overlapping strokes. Although this method works well to clean around appliances, it makes no contact under the gums, leaving behind bacteria and requiring modifications. When using the occlusal brushing method, the remaining half of the appliance is cleaned. This technique is also used for patients with a bridge closer to the gum line. The occlusal brushing technique. This technique is used in addition to all previous methods to remove debris from the pits and grooves of the teeth. Place the brush parallel to the end of the tooth surface. Apply moderate pressure and make slightly circular movements while keeping contact with the tooth surface. Move to the next area while making overlapping strokes. End tuft brushing. An end tuft brush is drastically smaller than an adult-sized toothbrush. A regular-sized brush has too large of a head to fit between the back jaw and the tooth. The end tuft brush is the perfect size to squeeze between the two and adequately remove the plaque. An end tuft brush can also be used to brush around malaligned and missing teeth. It is just small enough to focus on the one area and turn in ways that a large head cannot. Electric toothbrushes are great alternatives to manual brushes. Power brushes are great at removing plaque biofilm due to the rapid rate of bristle movement and little technique required. The disadvantages of a power brush include the higher cost, heaviness, and size of the brush handle. Electric Oral-B brushing. As instructed by Oral-B, power on the brush and place the head along the gum line. Apply light pressure and incline, leaving the brush on each tooth for 2 to 3 seconds before moving to the next. Do not make brush strokes, instead leave the brush still and the rotating head will brush for you. Electric Sonicare brushing. As instructed by Phillips, power on the brush and place the bristles along the gum line at a 45-degree angle. Use light pressure and move the brush along the gum line. Once again, do not make strokes, but let the vibrations of the brush clean the teeth for you. To care for your toothbrush after use, rinse the head with hot water and shake off the excess. Store the toothbrush in an open area with light to prevent bacterial growth. Patients often keep brushes in a cabinet or drawer, which produces more bacteria. Replace the brush after 3 months. Tongue cleaning. When using the toothbrush, place the brush on the tongue at a 90-degree angle with the tip facing the back of the mouth. Using firm pressure, brush downwards on all surfaces of the tongue, including the tip. When using a tongue scraper, place the tool on the back of the tongue and scrape down using firm pressure. Repeat until all surfaces have been scraped several times. This removes the bacteria and helps prevent bad breath. There are many kinds of string floss, two of which are waxed and unwaxed floss. Unwaxed floss has added color and flavor. Unwaxed floss is not smooth and is more likely to cause injury to gum tissue. It also easily breaks and frays when moved across a rough surface. This floss is recommended for children because of the flavoring, patients with tightly spaced teeth because it is thinner floss, and patients who prefer flavoring. If a patient prefers flavor, they will be more likely to floss when given this option. When wax is added to floss, it creates a smooth surface that easily glides between the teeth, which reduces the likelihood to cause injury to the gum tissue. The wax also minimizes the breakage and fraying of the floss when moved across a rough surface. Wax floss is recommended for patients with restorations and other rough surfaces on the tooth. Disadvantages of both unwaxed and waxed floss includes optimal dexterity and shallow gum pockets. PTFE floss is a floss made of material that is often used for fabric. This floss is optimal because it resists breakage and shredding and requires less force to slide between the teeth, which will increase the likelihood of a patient to floss. The disadvantage of this floss is that it glides too easily and leaves behind plaque biofilm. Using string dental floss. Wrap the floss around the middle and index fingers until a half-inch piece of floss is pried between the thumbs. The less floss used, the easier it is to control. Carefully insert floss between the teeth, creating a C shape around the tooth. Gently slide the floss down just under the gum line and slide back up without losing contact with the tooth before reaching the top. Remove the floss from the space and repeat on the opposite tooth. Before flossing a new space, wrap the floss around the fingers to get a new, unused piece. Avoid snapping the floss into the space to prevent injury. Do not use a sawing motion to guide the floss. This can cause an indentation in the tooth surface to form. Using a floss holder. Hold the plastic handle and insert the floss into the space. Press against the tooth surface to ensure floss remains in contact with the tooth before removing the holder from the space. Once at the top, remove the holder and reinsert, this time against the opposite tooth. Before repeating the next step, wipe the floss with a clean piece of gauze to remove contents. This will reduce the spread of bacteria throughout the mouth. Although the floss holder is very convenient and requires less technique, it is less effective in removing plaque biofilm because the floss cannot wrap all the way around the tooth, creating the C shape. Tufted floss is a floss with a thick fibrous portion which is used to floss large spaces created by orthodontic appliances, under bridges, and the side surfaces of teeth bordering a space. When a patient has a bridge, regular floss cannot be utilized. Instead, a tufted floss is threaded beneath the bridge and maneuvered to remove the debris. Using gauze. Unfold and stretch a clean piece of gauze so that it can be wrapped around the fingers for use. Use the gauze like a large piece of floss to swipe across the back surfaces of teeth to clean. Use a clean piece for each tooth. Gauze can be used in the same way to clean the sides of the teeth bordering a missing tooth. Using a water flosser. Place the tip of the flosser between the teeth along the gum line and power it on, keeping the mouth open. Allow the water to pass through the teeth for a few seconds before moving to the next tooth. After flossing the outer surfaces of the teeth, turn the flosser so that the water is angled to flow from the backs of the teeth and repeat. Using a water flosser is a good interdental cleaner for all patients and a great alternative for patients with low dexterity and hands too large to use string floss.